If I could have you all direct your attention up this way. The wine is delicious, the food is amazing. Alright, everyone in the back, give me a wave if you can hear me in the back. How far back does my voice travel? Alright, we got there. Any further? Alright, we're quieting down. Everyone, eyes on me. I was a camp counselor, I can do this all night. Alright, thank you everybody. I'd like to turn it over right now to your wonderful host, Miss Katie Tollefson.
Hi everyone, just wanted to do a few quick announcements before we get started. First of all, I wanted to thank our wonderful sponsors for tonight. We have Xealth, IT, Solucio, Partners, and OTP Solutions, and also want to thank Xealth for being here and speaking, as well as Swedish. We also want to thank Structure Sellers for being wonderful hosts once again. This is our third event here, and they've been wonderful. So make sure to buy a lot of their wine if you like it. They have a great wine club. I'm a member. It's great. So this is our third event we've had for the Emerging Technology Series. And so I'll be sending out a survey in the next day or so. So if you guys have any feedback or have any ideas on future topics or want to be a sponsor, please make sure to let us know, because we want to keep this going because it's been a great success so far, and we want to keep on having more. So next slide. Go back there.
There it is.
Oh, there we go. So we have the second part of the series. We're going to be doing an event focused specifically on career development. So if you're interested in learning more about careers in digital health innovation, it's going to be on April 4th at Cambia Grove, downtown Seattle. We have a really packed panel from Xealth, 98.6, Airvale, Medbridge, Seattle Children's Hospital, and Twistle. So if you're interested in that, look for the sign up coming your way in your email. A few other HIMSS announcements. We do have a scholarship program that we're about to announce. It will be due the end of April, so we have scholarships for undergraduate students, graduate students, students or people interested in pursuing a degree in advocacy, and also certificate programs. So if you guys are looking for some extra education, we are supporting you in that. And we also have a lot of people who ask us about ways to volunteer. We have 3 new opportunities. I have Dwayne here. He's our new programs chair. He's starting a programs committee.
All right. Hi, thank you. My name is Dwayne Neufeld. I am the program chair for HIMSS. So that means we are involved in helping us set up events like this and trying to make them more professional, but this event is very professional. So just adding more, what we're trying to do is add more. Vacuum out of it. We are building on the success. What Kaylee's been doing through the emerging technologies is to create an avenue so we can bring in more events. We have a lot of people with content. We just want to make it very easy to get those events going. So this started off with about 50 people. Now we're up to 125, so it's incredible success. And as the program chair, I host an advisory group with CIOs and CMIOs. And one of the things they talked about was collaboration being a key to why they wanted to meet. And the whole goal of these meetings is to help you collaborate and get together. So the more you can be bringing out your friends and colleagues to these events, the more we talk outside of our silos to each other, it means we can make healthcare better for everybody. So there's a newsletter going out this week, and you'll see an opportunity to join the program committee. We're going to have a Zoom meeting next week. You can find out more about what we're doing, and then go from there whether you want to be involved more. But thanks very much for showing up and being part of this event.
And we have 2 more committees. Artina is our sponsorship chair, so if you're interested in getting feedback on our sponsorship programs, there'll be more information coming out on that. And then Kelly Nettle over here started a clinical informatics committee as well. They meet about once a week, once a month. So if you want to learn more about that, they'll be coming out in our newsletter. So we are going to be filming tonight, so just want to let you guys all know that. There's cameras right there, so just if you can, stay away from that. If you are asking a question, please raise your hand and we'll try to bring you a mic so they can hear. We do have to be out of here at 7 o'clock sharp. There is a pizza parlor next door, the Nine Pies Pizza. They're great, so we usually tend to go there after if you want to continue networking and the conversations. So I don't know if you guys have been to one of these in the past, but what we do is we do a quick 15-minute talk, we do 5 minutes of questions, and then a quick wine break in between, so if you need to refill your glass, there's opportunities for that, and for networking and mingling, so you're not just going to be listening to them talk for an hour and a half straight. So I want to introduce to you our speakers. Dave.
Hi.
Okay, you guys can all come up here. We're going to get started. Come up here. And I'm going to let you guys introduce yourself and get started.
I'm Sundar. I'm the Chief Product Officer at Xealth. Oh, yes.
Sorry. Can you guys hear in the back? Can you guys hear in the back?
No. Is this better? Okay.
Try it. Hold on.
All right, all the way to 11.
Set it to 11. If you stand a little farther away from the speaker, it won't feedback.
Okay. Get over here. That's a great idea. So, yeah, I'm Chief Product Officer of Xealth. We were a spin out from actually Swedish/Providence. So the folks at Swedish heard lots of, I'd say, naive ideas about healthcare from us before we actually came up with Xealth. Go this way first.
I'm Sandy Hungerford. I'm the Director of Clinical Integration and Informatics for Xealth. I also used to work for Providence Innovation Group as the Epic Architect, and when Xealth spun out, they dragged me with them.
Hi, I'm Dave. I'm a technical product manager at Xealth. I oversee some of our accounts, onboarding digital solutions for different hospital systems. Excuse me. Been with Xealth for about a year now. Before that, I was with the Department of Defense, Defense Health Agency, building apps for service members. So happy to talk to anybody about the cutting edge research the DoD and VA are doing. Cutting edge. I'm happy to talk with you about it. I'm the same.
Hi, I'm Mike Mint. I got into college the old-fashioned way, just saying. I'm an infectious disease doc and at Swedish. And interestingly, I am currently medical director of population health, but I've done a lot of work around quality, safety, and others, including informatics. And interestingly, Xealth, when the team came into the digital innovations group at Providence, I met with them. And they said, hey, what problems in healthcare need to be solved? And let's start talking about it. And then they went from there. I can't claim any credit for what Xealth has become, but it was cool to have some conversations with them and saying, hey, there are a lot of challenges in healthcare, and we'll talk about some of these today. And so I'm excited to be here and chat with you all.
We're going to talk about a couple different areas about digital health, give you an overview of the digital healthcare landscape, sort of briefly cover what are we talking about when we talk about digital health, what are some current trends, where it's going, give you some options of things that we're doing today in digital health. Xealth, we can talk about a few things that we're doing. We work with hospital systems across the country. I will save it to Sundar to explain more about what we do. And then talk a little bit more about lessons learned, things you need to think about when you're considering digital health strategies at your respective organizations. And then, of course, we'll open it up for questions sort of after each section. We'll probably have about 5-minute Q&A, so feel free to fire away. Let's jump right in to sort of what is digital health and what do we mean?
So, digital health, everything I've done has had a core definition to it. So when I did quality, I went around my groups and said, hey, define quality to me. And for 10 people, I got 10 answers. Population health, 10 people, 10 answers. And digital health, or digital health strategies, 10 people, 10 answers, as you can imagine. And so the way that Providence St. Joseph's in Swedish, as a part of the Providence St. Joseph system, we've looked at it as sort of an evolution from Healthcare 1.0 to Healthcare 2.0. And I just briefly want to walk you through kind of what our thoughts are and what that means. Healthcare 1.0 is really designed around the healthcare delivery system, hospitals and clinics, right? And that's where patients came to us. To get seen, we would bill for that and then repeat cycle, right? Over and over again. We would miss a lot of patients who couldn't make it to us. We wouldn't have a ton of interactions, maybe some phone calls and things. But it was really centered around the hospitals and healthcare delivery organizations. And you can see what that looks like. I would say that currently in the United States, we're probably at a little bit of healthcare 1.5. And that's this middle one, where it's now becoming much more centered around patients and communities that we serve. It has a bunch of surrounding services, as Dave is, sorry, Ivana, can you point that out? Sorry, can you go back one slide and just, we'll just kind of walk through that. So Ivana is showing you that, that Healthcare 1.0 starts to have some surrounding services around the patient, but still is evolving from a healthcare delivery standpoint perspective. And Healthcare 2.0, Dave, thank you, Dave, is now really around digitally enabled patients. And so digital health from our perspective is digital tools that allow healthcare organizations and other organizations, that may be an employer, that may be folks, community health organizations, reach out to patients and care for them across the continuum of health, not geographically limited to the healthcare site, and focus not only on healthcare, care for the sick, but also wellness. That is keeping people healthy, keeping people productive, and letting people optimize their lives. And you can see in Healthcare 2.0, I'll tell you when to go forward there. Healthcare 2.0, now all of these, including hospitals, healthcare, are wrapped around the patients. But further, this outside layer starts to get into digital assets. You can see telehealth and genomics and other things that are really made around the patients and communities to support their perspective on health and wellness. And the healthcare delivery system starts to become an enabler for this and not just the center of gravity around patients' health and wellness. Next slide, please. So just again, the way that healthcare organizations historically have optimized is that in Healthcare 1.0, you want to be a greater share of the inpatient market. Like that's, it's all about the visits, the RVUs, if you will, and that's our financial model in the United States. We didn't invent it, but we live in it. Healthcare 2.0 now starts to get to accountable care contracting, bundle payment models, and other things that Medicare is really driving to, and many of the employers are really moving towards. And in Healthcare 2.0, when you're fully into this, now digital health really allows us to care for those patients that are not directly in front of us, to enable them to emphasize their wellness and health, and be an enabler, not just for healthcare delivery organizations like a Swedish or Providence, but also anybody else who's interested in this space. So that's kind of our perspective from a healthcare delivery organization.
So let's talk about what that actually looks like in practice. So, what kinds of things are happening now in digital health trends?
And so when we look at this, the perspectives is kind of a three-part pillar as we look at. And when we look at from a healthcare delivery organization, those three buckets, we look at clinical processes of care. I broadly define these terms, right? And then structures of care, and then digital health tools. And you can see the Venn diagram overlap. And ideally, we're starting to aggregate these and push these three circles together. But I like this kind of slide because it sort of shows where we trip over ourselves and where we optimize, right? Where we optimize is where the structures, processes, and digital health tools come together. And that's that center portion, the digital high reliability, where digital health is actually enabling patients and those that support the patients in this optimize their health and wellness over time. Where we fail is where only the health tools and the structures come together. We buy the product, we put it in place. Let's say DHR sometimes, and it becomes digital distractions because it's not connected with the clinical process of care. So me as a physician, seeing the patient in clinic, it makes it harder for me to care for that patient that's in front of me. But the other Venn diagram where it doesn't align is when digital health tools and the clinical process of care are not aligned with the structures. And what I would say that would lead to limited adoption, right, if it's not set up that way. And so as we think about digital health and what makes it successful, which will be this section and the next section, this is a framework that we use.
Yeah. So something, a good practical example of this, of something that lives in maybe the limited adoption part of the Venn diagram today, and is moving towards that happy middle, is something like a workflow tool for helping patients prepare for a surgery. How many of you have maybe had a recent surgery, know somebody who's had a recent surgery? Please no hands, that's PHI. That's right, ladies and gentlemen, you come for the healthcare jokes. I appreciate it. So a good example of that there are a number of vendors on the market now who are engaging patients with texts, with emails, helping you prep. Are you ready? You've got a surgery coming up. Stop this medication today. Start drinking that horrible stuff for your colonoscopy. Do you have a ride? Do you have somebody to take you home? All with the idea of the better you prepare that patient for that surgery, the more you reduce the chance of that no-show rate, and the better experience you as a patient have with that healthcare system. Last time you get this sheet, right? You get that one-page handout that's confusing and doesn't cover everything, and how many times do you lose that piece of paper, or it's, trying to remember you're calling the office, what am I supposed to do when? We all live on our phones. Let's start engaging patients where they're living, where they're at. So that's a good example of things that are happening now. Another one is connected devices. We're starting to learn how to do this better. We're starting to identify ways to keep maybe some of the older patients out of skilled nursing facilities. We're going to engage them where they're at. We're going to give them connected scales. We're going to monitor them at home, maybe call in a nurse if we need them to, but otherwise we want to lower the cost of that patient and, again, make it better for that patient. No patient wants to go to a SNF. No patient wants to go to a nursing home. They'd much rather be at home. So the longer we can keep them there, the better kinds of outcomes we're going to have. And that's one of the things that digital tools are enabling us to do today. Now, looking forward, again, what the future holds is how do we make that better for the patient throughout the healthcare continuum? How do we make it easy for you to get to your appointment by ordering you a Lyft ride, and then maybe we answer some questions along the way. And so you don't have to sit in the doctor's office and fill out that paperwork. You fill it out on the ride to the doctor's office. How many of you would rather have all of your crutches and all of your healthcare equipment waiting for you when you get home rather than have to go to a medical supply place? We can enable drop shipping of those things right to your house so that they're there when you get home. So these kinds of things are what is in the near-term future for digital health, and the kinds of things. Yeah, you're going to read about AI, you're going to read about blockchain, but I mean, come on, that's what sells headlines. That's still years away. I'm talking about practical stuff that you're going to see in the next 1 to 2 years that is going to have an actual benefit on your healthcare outcomes. So we got about 5 minutes left for this section. Anybody have any questions, comments for Mike, myself on anything we've talked about today, things you want to hear more about? Yes.
Are you able to talk about any of the specific tools or technologies that you're using today that you're finding very effective?
I could start. Condition-specific tools to help patients navigate through the complex maze of healthcare are really some things that we've really engaged with. So I'll talk just briefly about Circle Lab, and I'll hand back to Xealth. But for childbirth, that's a very discrete group of sort of expectations and tasks that both patients and the caregivers have, and connecting them throughout this is more than just those prenatal visits to your obstetrician. It's really about nutrition, it's really about wellness, it's really about answering questions and educating and doing all the things leading up to childbirth and then obviously beyond. And that's something that we find as really important. We use a certain app called Circle that has been integrated with Xealth. But Xealth kind of has also a lot of different use cases. But I think that as we look at episodic sort of care, that especially an easy place to start is those with the beginning and an end, like a total joint replacement or birth.
So I'll tell you about my favorite tool that I have, the thing that I've seen that I like the best. I have no interest, we're not working with these people. I just really like what they do. It's a company called Scanslated. Have you ever tried to read an MRI report? Have you ever tried to read a echocardiogram? Anything you get from your doctor is incredibly hard to read. For me, I have a doctorate, and this is hard for me to read. Try explaining it to your mom, your dad. What Scanslated does is you scan in that report, they use natural language processing to translate those terms into real-world English and give you oh, this is the part of the brain that your doctor was scanning. It deals with language. Working down to that level that we can kind of all understand. And that's a thing, again, an example of a really cool thing that I think is going to actually help patients and gives a good example of those tools. How are we doing on time?
3 minutes.
3 minutes, okay, good.
Hi, my name is Adrienne with Providence St. Joseph Health. As a physician leader and an advocate for health technology and innovation, this is a two-part question. One, how do you influence and convince your physician peers to start utilizing technology, and also to enable and empower your patients to feel comfortable to use technology as a means of access to care?
I think that's a really wonderful question, and I will answer to the extent I can, and if you have a better answer, let's talk, because we need to solve it. The challenge of adoption gets a little bit to this slide here, right? And I think that the way to engage from the provider side is really hitting that sweet spot here, the structures and processes. And docs don't always think in these ways, but we can, right? And sort of HIMSS and other venues, we look at how do the tools support the ultimate mission and vision of the organizations that we all work for. And what I would say is that the more we can convince from the care delivery side, that sweet spot, the better off we are. And I can't emphasize enough the structures of care. The accountability, the compensation, and those things. If we're compensating people to do X, they will do X. And it's a fallacy to compensate them for digital health, to reach out to patients and answer the emails or the digital text back and forth that we do, if we don't align the compensation system around that. So that's from the provider side. From the patient side, I think it's really interesting, and I think Xealth, and I'd love to hear from our Xealth colleagues on this. The challenge is that there are innumerable number of vendors out there that, all well-meaning, want to interact with patients and interact with the healthcare delivery medical homes, if you will. And the challenge is, how do you prevent that from becoming spam? Like, just like, okay, now I have my OB app, but I also have my breastfeeding app, and I also have my, like my kid vaccination app, and I also have my, whatever apps. And what Xealth does is give a standardized platform for doing this, and this isn't a commercial for Xealth, but the solution is, how do we make it easy for patients to make it so that this is your medical home that's interacting with you. And if not, that's fine. If you want to interact with naturopathic space or homeopathic space or others, that you control that as a patient. But if you want to link in with the allopathic world, how do we connect the dots between that and generate trust with the patients that this is not just another spam email from from Nigeria saying that I have $1 million from somebody.
And we have a whole section on that later too, about how do we increase adoption with providers and patients. And I'll talk about the work that we did in the DoD, where we actually stood up a whole training program for providers, because again, as someone, this was not something they covered in my training program about how to use apps with patients. So I think there's an element of that. I think we have time for one more question before we break. Anyone? Yes?
So basically, I heard you just said about trying to use a platform for patients. But one, I'd say patients are actually, they're people, they're not patients. And two, everything you're talking about is transactional. Where are you building out a model for understanding who people are? Because fundamentally, it ain't dog food if the dog don't eat it. And I don't see having transactional text messages as the secret that will change that. What are you doing about that?
No, I love where you're going with that. I mean, the patient-centeredness of all of this gets into the prior slide of the Healthcare 2.0, where patients are driving their own. And as a physician that trained in the old model, I refer to patients as patients, but they are people who are empowered. Digital health in its ultimate form empowers them to manage, own, and control their health and wellness. And as a healthcare delivery system, you're really calling out a really kind of flaw in the way that we've delivered this in the past. And I'll say that this is a really challenging space to be in. But what digital health does ultimately is allow the patients to control how they interact with either the healthcare system or with other options of health and wellness that are out there. And from a healthcare delivery system, and again, I will speak from that perspective because I come from that perspective, our ultimate missions are really theoretically aligned with patients around there. Historically, we haven't always delivered on that. But digital health allows us to build sort of methods that patients can be empowered. And let's just use a very simple example. Measles and immunizations. The problem with the current sort of way of Dr. Google is that you can justify anything you say. Aliens are on the planet and don't want me to vaccinate my kids. And you could justify that, right? So how can we create as a healthcare organization and add value to the patients from being a person, right? Being a person. Trust that we are their advocates and that we want to build a long-term relationship with them of trust so that we can be, and I always joke around a little bit for the diamond commercials, like you have a friend in the healthcare wellness space. I would love for Swedish and Providence to be that friend in the healthcare space that patients feel confident to ask us questions, we can answer them, and if appropriate, we can deliver services to them. But if not appropriate, they can go to other sources. And I think it's a tough space. It's a great question.
Okay, so that wraps up the first flash talk. We're going to have 2 more, but right now we're going to break for about 10 minutes. I want you to talk amongst yourselves about what you've learned. The people in the back are already doing it. Follow their lead. Talk amongst yourselves. We'll be back in 10 minutes, everyone. 10